these. You just, yeah, I guess.
Everyone, and welcome to the first day of the run-up to Pain Awareness Week with Understanding Supportive Pain Self-Management, the Interdisciplinary Roundtable series. Over the next 3 sessions, today, Wednesday, and Friday, we're bringing together advocates, people with lived experience, and multidisciplinary professions who each bring a unique perspective on how people living with pain can be supported, not just through treatment, but through connection, education, and collaboration. For day one, we are joined by Virginia McIntyre, from the People in Pain Network, Tyler Dillman, a physiotherapist and owner of One-to-One Wellness, and Jessica Friesen, a psychologist who works with One-to-One Wellness. Together, we'll explore what supportive interdisciplinary self-management really means, how different disciplines and communities can work together, and what practical steps can help improve the lives of people living with chronic pain. Now for some housekeeping items. If you have any questions for our panelists, please put them in the chat and we'll get to them in the question and answer segment of the presentation. We have closed captioning enabled, and this presentation is being recorded for those who cannot attend at this time. All participants will be muted, and we ask that you also turn off your video so only the presenter will be in the video. All links put in the chat are safe links. I am Trudy Flynn, Chair of the Board of Directors of Fibromyalgia Association Canada, or FAC. I'm going to keep my comments brief so we can get right to the presentation and the roundtable. I would like to begin by acknowledging that we are on the traditional and unceded territory of Indigenous peoples across Canada, including First Nations, Métis, and Inuit. We honor their enduring connection to the land and are committed to fostering respectful and meaningful relationships with all Indigenous communities. I acknowledge and give thanks to the land on which we live, work, and play, to the people who have cared for it. I am speaking to you from Mi'kmaq, the ancestral and unceded land of the Mi'kmaq people. In Nova Scotia, we are all treaty people. So now I'd like to introduce the panelists. Virginia McIntyre is the volunteer president and executive director of the People in Pain Network or Society. Her dedication to improving pain management and raising awareness about chronic pain is evident in her active participation in numerous research projects and initiatives related to pain management. She serves on several influential committees, including Pain Canada's National Advisory Committee and the U.S. Association for the Study of Pain's People with Lived Experience Committee. Additionally, she chairs the Canadian Pain Society's Communication Committee and the People with Lived Experience Committee. Virginia is notably the first Canadian with lived experience to be awarded the May Day Pain and Science Fellowship in 2023-2024. Virginia co-hosts a compelling new podcast, Action on Pain, that amplifies the voices of people living with pain and is grounded and for pain. Her ongoing work as an international presenter, educator, and advocate highlights her commitment to advancing the understanding of peer support and management of chronic pain. Jessica Friesen earned her master's in psychology from Walden University and holds bachelor's degrees in developmental art and education from the University of Calgary. She works with individuals, couples, families, and groups using evidence-based approaches like cognitive behavioral therapy, dialectic behavior therapy, acceptance and commitment therapy, and emotionally focused therapy. Jessica enjoys helping people navigate challenges such as anxiety, depression, ADHD, trauma, life transitions, burnout, and chronic pain. She understands that these challenges can affect both the body and mind and works with clients to build coping strategies, improve emotional well-being, and regain a sense of control. Her approach is tailored to each person, creating a safe space where clients feel heard, supported, and empowered. Tyler Dillman is a physiotherapist and owner of One to One Wellness. Tyler is dedicated to creating a safe environment where individuals can build healthy habits and enhance quality of life and stay active in what matters most to them. A graduate of Dalhousie University's Master's in Science of Physiotherapy program, he also holds degrees in psychology from Mount Allison University and kinesiology from Acadia University. With strong interest in pain science, behavior change, and chronic pain, Tyler's whole person approach recognizes that health is shaped by the complex interaction of biological, psychological, and social factors. By listening and validating each person's experience, he develops meaningful, individualized treatment plans that empower clients to take an active role in their recovery. Outside of work, Tyler enjoys time with his wife and two sons, exploring local hiking trails and keeping up with fantasy sport. Thank you very much to our panelists for coming today and giving important information that we can all use as people who live with pain. And now I will turn it over to panelists. Virginia, I think you're first.
I think so. Thank you. And thank you for the wonderful introductions. We just wanted to remind people, and I put in the chat, that you may want to turn your camera off during our presentations because that we'll use for other events later on too. So you won't have your picture during the presentations, and then we'll have time to chat after. Okay. Can we see that now?
Yes, just click on the present mode, Virginia. There.
All right. Thank you. Get my timer going. All right. Thank you. And thank you for the wonderful introduction, Trudy. So my name is Virginia McIntyre, and I'm going to talk about the power of peer support in driving positive change and its role in pain self-management. So first about People in Pain Network. People in Pain Network is a registered society in Nova Scotia since 2021. But People in Pain Network has been around since 2011. It first originated in BC and then moved its way to the East Coast. It is driven by volunteers. We are a complete community of dedicated volunteers. We are also a nonprofit society. And what we do is we offer free monthly meetings, offering a balance between education, that is pain education, self-management, and support. So a little bit about me. I started with a workplace injury in 2008, which led to a shoulder surgery. Which led then a couple of years later to a referral to the pain clinic. But within those 2 years, I jumped around from care provider to care provider, trying to find out why I was left after this surgery with this excruciating pain. And unfortunately, there seemed to be a real gap in the knowledge about pain. So that led to going to another surgery in 2011 just to find out what was going on. But at the same time I went to the other surgery, I did get a referral to the pain clinic at the same time, which was there where I learned about pain and about the role of multiple people in the pain care to help me to actually return to work in 2011. Recognizing the huge gap in pain knowledge and supports within our communities, we opened our first peer support group with at the WKM, the Western Zone here in Berwick Pain Clinic in 2017 with their support and registered the society in Nova Scotia. Through peer support has guided me in navigating a life with chronic pain. And since then, I've been able to not only get back to work, but become a pain educator, an advocate, a peer specialist. So, what is a peer support? And that's what we do in within the People in Pain Network. We offer peer support. So that is us sharing our experiences. That is our whole lived experience with each other. This has been around for a long time. We provide a space where people feel accepted and understood. It's so often we're felt misunderstood in this space. We don't get that because we know what each other is going through. It's bidirectional. So it's not just us receiving something from people within the group or us giving to them the education, but I've received more from them than I could ever imagine. How to live with the pain, how to take the science and adapt things so that I could keep having less and less pain or less medications. It's been really important for me and a movement forward. Peer support, it provides the social, the emotional, practical, and knowledge base. It really covers a lot of avenues for people. So peer support provides empathy and understanding. It increases hope. Seeing others who live with pain be able to manage their life increases hope, gives people an idea that they can do this too. Something we often hear within our community is it provides a home base for people. It's a confirmation that we are not alone. There's other people going through the same struggles. It improves our self-esteem, self-awareness. It builds on or improves our existing self-management skills. So that's what we're about, is our self-management skills and in complementing what the healthcare providers do. We, ask the people who attend our groups why they attend. And it's really what's important is what we hear from them. We ask them, is it to connect with others, to increase their knowledge of persistent pain and pain self-management, or to provide support to others? And as you'll see right there, it really is, it's about all of the above. People in Pain Network has a structure for a group, and it's important to have this structure because people know what to expect when they come to the meetings. We have a welcome, we have comfort agreements that talk about confidentiality, using the I statement, the opportunity to pass if you don't want to talk. We have a check-in, how their month was, an opportunity to share their experiences. And we most all the times have an education session. Now, on pain management, it can be from pacing to pain science, to grief and loss, to movement. It is whatever the people who attend these meetings want. They get to decide the topics. We've done music therapy, and we wrap up with either guided meditation or a quote and feedback. We want to hear from our members what's working and what's not working. So about people in pain facilitators, they are trained. They just don't come to these meetings and run them. They're trained. We ask them to attend our meetings for 4 to 6 months to make sure we're fit for them and they're fit for us. We do ask for a background check. They're provided with facilitators agreements, again, giving them an idea of just what we expect from them and what they can expect from us. Our facilitators are provided an extensive training with our national organizations. And this is a training that is built underneath the Canadian Mental Health Association with a pain component. This is a 5-week training that they're provided. Training doesn't stop there. We do more training on facilitators basics about People in Pain Network. They're provided a national dashboard where they can do monthly training. People in Pain Network, we do quarterly debriefs and site visits, and we have now had 2 in-person workshops where we were able to even build on their existing training. To have an idea of what our facilitators training is on, it's on things like understanding their personal pain experience, to know peer facilitators, their role requirements in this role, how to use their experiences effectively, practice cultural respect and safety, build strong interpersonal connections. Competency also includes communicate clearly and empathetically, how to handle crisis interventions, resolve conflicts constructively, demonstrate self-awareness and confidence. We also talk about open-ended questions. And that's just some things. Our facilitators are provided a dashboard. This provides them with continuous training, and if they can't meet the training sessions that are provided with our national partners, they can also go into the recorded sessions. They're provided materials. Their materials they run their meetings with are there's 34, I think 34 education materials, and it's with our national partners with PIPN Canada, which has many, it's everything you imagine, pacing, anxiety, grief, but it's all evidence-based and provides slides that they can run these meetings and guide these meetings through discussion and through education. So everything is provided there for them. So as a result of participation, we asked our members again, what, as a result, what has been the result for them? Like, we've asked, have they had more confidence in their pain management skills? Do they feel that their emotional well-being is improved? If they believe their overall health is improved, that their quality of life is improved. And as we ask them through the participation, what has happened? They say all of the above. Our members are really moving forward by being a part of these peer support groups. So those who aren't familiar with, Health Canada has developed a action plan for pain in Canada. And within that has 6 overarching goals with 122 recommendations. This document and Health Canada have recognized peer support as a core recommendation of this plan. They recognize the role of peer support for people living with pain. Power of Pain portal provides a hub of resources for people living with pain. I would suggest anybody who's not familiar with it to look it up because it has everything under one umbrella for you. They also recognize in the stepped care model that peer support is recognized as a part of this model. So People in Pain Network now has been very successful. We started off with one group in Nova Scotia, and now we have 7 groups between virtually and in person. Our success, I count on a lot of things, and one huge thing is a personal wellness, and that is personal health and self-care strategy are provided to our facilitators and our members. This is very important. We talked about a structure to groups structures. That is important. The structure of the groups provides mutual support and an understanding in what's going to happen within these groups. Facilitator training. We have targeted facilitating training and ongoing professional development. This provides our facilitators with the tools that they need to run an effective and a safe place for these meetings. It also helps them feel appreciated and confident in what they do. Our meetings offer a balance between education and emotional support. We are a knowledge-driven approach. Collaboration network. We do not do this alone. There is no silos in pain management. It's that team approach, and that's the team within People in Pain Network, our facilitators, our volunteers, people help with the communications, and also our organizational partners like FAC, who is on here, and One-to-One Wellness, and our national partners, PIPN Canada, Power Over Pain portal. It's through these connections and what we do to develop curriculums for these connections that really has made us a huge success. We can't do this alone. So within People in Pain Network, we do offer a range of meetings to accommodate individuals' needs and preferences. Virtual meetings provide flexibility and accessibility, allowing individuals to participate from anywhere with an internet connection. In-person meetings offer a sense of community and connection, fostering direct interaction and support among participants. You can find out about us on our website. We now offer 4 virtual meetings, one dedicated to young adults, a morning virtual meeting, an evening, and we've now also offering a sit and chat where people just might want to come and sit and chat for an hour. We offer 3 in-person meetings, one in Sydney, Nova Scotia, one in Berwick, Nova Scotia, and one in Greenwood. When you're looking for meetings to go to a support group, it's very important to consider things. Consider what is best for you, whether it's what your needs are in the time at that time, and the challenge you need for pain management. Consider your values. What values are most important for you in a support group setting? And even within our different groups, different facilitators run their groups maybe a little bit different and might be a facilitator that you connect more with. Consider your preferences. Consider the type of environment, whether you prefer virtual or in person. And as I had said, because they're done Zoom, you do need that internet. But we have recently in Nova Scotia partnered with Seniors Connect, where it's done through phone lines for seniors, where they can come in once a month and learn about pain and self-management too. We're thrilled to offer multiple resources for people living with pain. So we have our peer support, which you can find on our website. Also on our website, we house these resources. We have Dr. Andrea Furlan. Power Over Pain Portal is a real hub of resources for everybody. The Pain Toolkit, Pain Canada hubs of resources. We also do have one-to-one wellness on our website. So I'd like to thank you for joining us, and we will have questions later on, and I am pleased that I have stayed within my time.
Thank you, Virginia. We will turn it over to Tyler.
Great. Thank you, Virginia. It's always a feat when we can stay on time on such important topics. Just going to take a minute to share my screen here. While I am doing so, slideshow. There we go. Okay. First, I want to thank everybody for attending, and for today, and hopefully for the rest of the week. We've hopefully designed and brought together a great group to help provide some wonderful information, and continue to share and provide evidence-based resources for those living with pain, which can be difficult to come by. Also want to thank Fibromyalgia Association and the People in Pain Network for partnering and all that you do. It's so important. So thank you. As Trudy mentioned, I'm a physiotherapist and owner of One-to-One Wellness. And what I thought today, I would really try and bring in a bit better understanding of what physiotherapy is and how it differentiates a little bit in helping somebody manage pain versus, say, like an acute injury, and what most people think of when they think of physiotherapy, especially in private practice. Um, uh, okay, so what is a physiotherapist? So many people will go and say, or be referred to, hey, a physiotherapist, and just kind of show up and not really know what to expect, or what even a the physiotherapist is, and what her role is in patient care. And when we break it down and look at different like definitions, what we're really looking at is, you can expect us to have some knowledge and understanding of movement and physical function. So how you're moving in space and how your movement's related to those things that are necessary for day to day, but also the things that you really enjoy. And so we are regulated health professionals. So what that means is we have a governing body, we have to adhere to these rules, and we have a defined scope of practice that we have to adhere to. We are able to assess, we provide an assessment, we are able to provide a physiotherapy diagnosis, and we're here to help treat some of the physical challenges that are related to things like injury, pain, and a variety of other chronic conditions. And one of the main goals is, how do we help people either like restore, maybe maintain, and really optimize physical function, right? So our ability to move and complete tasks that are meaningful and necessary. And then in the big bit of the big picture is how do we help people with their overall well-being and improving their quality of life. And so when you're looking at, what is a physiotherapist? Why am I going to physiotherapy? Why am I referred to physiotherapy? This can be what you should expect. And I kind of label it as, what are we good for, right? What are we good for? When we're looking at the assessment and treatment plans and those types of things, what we're often looking at is how is an individual moving, right? And what is their general mobility, right? And how does that relate to some of the things that have been impacted by their current pain? And can we improve it? How do we maintain it? And how do we restore function that may have been lost over a little bit of time? We are also looking at general strength factors, right? um, General endurance factors of day-to-day and physical activity that can translate into to day-to-day type activities. So typical assessment and typical questioning is along the lines of these types of strength-related factors. How much movement can you tolerate before the onset of pain or before pain becomes not tolerable anymore. Those are types of things that we'd want to know. And then how do we relate that to overall function, right? So we're looking at the function. Is the individual able to get off of a chair or toilet, or how is stairs? Are we able to walk safely? How is balance within there? So often we're trying to take that information and relate it to function and goals. So that would be, I would say, most people would think of when they think of physiotherapists and what to expect, and kind of what we're good for, so to speak, would be in that realm. But on a bit of a deeper level, kind of what we're looking at too is the behaviors that have developed as a result of living with pain, or the current pain experience. Um, are we potentially avoiding things because we're scared of the current pain? And is that potentially making things a little bit worse and continuing to keep us withdrawn from these activities that are really meaningful? On the other end, are we looking at these aspects of, are we completely ignoring our pain and plowing into it? And is that sensitizing the nervous system to movement and those types of things? Um, are we avoiding social situations? So part of our assessment and understanding of the individual's experiences, we're trying to draw out this type of information that then we can relay to, say, our occupational therapists, or Jessica, like our psychologist, and say, hey, these are some of the things that I'm hearing that we may need to work on based on the overall goal that seems to be very, very important and meaningful. Other information. So we can do a really good job at finding information around sensory issues, right? Numbness, tingling, ache, pains, reflexes, and the neurological, and other tests, right? Is the strength issue related to more kind of the pain, or is the nerve communication and how that works, is that impacted? Because that will just influence treatment in a little bit different of a way. And that's information that we're relaying to like the medical community and the medical professionals on the team, because it may influence to take this, maybe a different medication or a different approach, and bringing all of things together. And then in the physiotherapy kind of context, we're also looking at, okay, what are the current strategies that the person has in place? And one, are they helpful? Is there a way that we can improve them? Is it feeding into a little bit of the behaviors that have developed in the coping strategies? Most people would be kind of thinking about maybe like, hey, I'm avoiding this during this time because I'm flared up, or it's caused pain previously. I use heat, I use ice, I use my TENS machine, and all of those are types of things that a physiotherapist can help you with and help you navigate of answering some of those confusing questions of, okay, I'm using these strategies, but when do I use them? When are they helpful? When are they maybe not so helpful? What are the parameters around that? Because a lot of that stuff can be tough to navigate. And some of the information that we're relaying to the rest of your healthcare team, and hey, like these are working and these are working really well. We should be reinforcing this as we go. Um, and so, like one of the big things that we see from the physiotherapy lens in a bit more of a pain management model is the active listening component. We really need to be good listeners, and we need to provide people with space to share their story without interruption and without judgment. And and when we do, like what are we starting to hear, right? And this goes into helping the other team members understand what's happening from a functioning and movement perspective, and, and important for healthcare providers. Any healthcare providers watching should also be an understanding that we are hearing that in the physiotherapy context that there's a sense of lack of empathy and understanding for the patient that's in front of us. And so we need to acknowledge that and do a little bit better in creating that space and educating ourselves to better understand the experiences that and the suffering that can happen when somebody's living with pain. There is most often a desire and a need to be physically active. And what we hear there is often it hasn't quite worked before for a variety of different reasons. Um, but the want is there. And when people are wanting to move and they feel the need to move but don't know how, that can be a bit of a challenge of how do we navigate that conversation and where do we find that proper starting point. And we know that when people are moving a little bit more, typically their pain is the intensity is lowered, and we start to feel more confident in our abilities to do things. And so that is really important to know that need and that desire is there. But there is on the other side of that that need for support, right? And adequate knowledge of how do I do this? How do I do this? um, because often I've been potentially guided wrong previously. It's led to flare-ups, or I try this, and I lead to maybe 24, 48 hours in pain, or it's weeks in extra pain. And so having a physio in particular that is understanding and has a knowledge of how to navigate those situations and can support you through the ups and downs of it all can be really, really important. And that there is like with activity there, especially starting out, we can expect a little bit of pain with that. But again, like how do we where's that line? And everybody is so different in their ability to tolerate just different fluctuations in the intensity, and then um and without overloading the nervous system in the body. So what we do here is we want exercise that feels good and that feels safe, and creating in a space that just feels not judgmental, where you can explore with kind of without the judgment of um, I'm not doing what others are doing, right? I'm doing what I can do. And so how do we create that space for movement and physical activity? And as Virginia mentioned with the PIPN, um, they like being able to create those spaces goes such a long way. Um, and so what are we considering as we're going through? What is a little bit of the difference? And most often when people are in a physiotherapy setting where they're thinking, okay, we're looking at the muscles and the specific uh, area of pain that's whether it be a shoulder or a knee. And but what we really have to start to do is we have to zoom out. Um, and when we zoom out, we're looking a little bit more at the nervous system and what is threatening to the nervous system. And with that in particular, movement and physical activity and exercise has often been very threatening, because movement provoked pain is a real thing, right? So we have to zoom out and say, okay, how do we um, create more positive nervous system inputs with the skills that we have available versus kind of negative nervous system inputs? And so one of the things that we would want to keep in mind is that a lot of people who have been living with pain for some time would have increased responses to pain, right? So in the hyperalgesia. And so how are we navigating movement and um, uh, in with the understanding of this, right? Are we taking a bit more of our time? Often are we using principles of like edge work and the senses of safety? How are those built in, right? How are we coaching that? Also understanding that pain thresholds can be down, right? Especially again when movement can stimulate pain and repetitive movement, right? So how are we? What education needs to be provided? Are we asking? We're often asking questions around fatigue and sleep disturbances because that's going to influence um, how much we challenge in a way, right? We're not gonna, or maybe do a little bit less at that time because recovery is so important and sleep is so important for recovery. So we need to take into account that these are factors in our treatment plans. Physical deconditioning. Most often people are a little bit deconditioned if they've been living with pain for some time because we the physical activity hasn't been able to be a common practice because of the pain that we're experiencing. So how do we take that into account and consider that? We're also looking at self-efficacy, so an individual's confidence in their own abilities to perform something. It's one of the questions that we try to almost like lead with before. What is your confidence in your ability to do this set of goals? And then using that, then we try to make it so that it is we try to set people up for success based on their confidence level and their own abilities. And then one of the more, I would say, important ones is, are we making meaningful, realistic and enjoyable goals? And how are we taking the time to really hear that? And if the starting point of movement exercises isn't really kind of going at that goal right out of the gate, are we making them transferable, the movement transferable to those, so that there's an understanding of why are we doing this? Are we trying to desensitize? Are we trying to build up in a bit more of a gradual way? And so some of the goals that we could expect, again, kind of in that approved self-efficacy. So, how it's kind of in a little bit of that conversation. Are we doing some goal setting? Are we seeing some improvements? Are we using maybe some of the brief action planning tools that we have available to us to set people up for success? Um, uh, are we trying to introduce some of the healthy behaviors that we know really change people's quality of life? We know physical activity is in there, but maybe that's not the best starting point for the individual in front of us. Maybe are we looking at sleep? Maybe we need to refer to back to the physician or sleep medicine specialist or someone to say, okay, we should be focusing on this sleep, or is it nutrition? Is it social behaviors, right? Are those the things that are a bit more meaningful, that bring people joy and can get people started on the right foot, kind of getting in the domino effect? Are people getting, are we helping improve an understanding of the current experience and of living with pain and how it fits into the goals? We know that certain education works very well, especially when it's delivered in an individualized context. Are we as providers listening to the individual and what they uh, how they perceive their pain and their body, and are there things that may be a little bit more kind of maladaptive that we want to address um, uh, in a bit of um, a gradual way of challenging the maladaptive beliefs that may have formed over the years from healthcare providers, who tend to be the biggest ones. And then, are we improving tolerance to those meaningful activities? Are you seeing those whether it be physical activity or being in a social environment and those types of things. Are you seeing the physical activity or the treatment plan that we've created? Are you seeing improved tolerance for those? And that's usually, again, the personalized approach is so key. There's no one size fits all here. And is what we've created within the team context kind of related to these enjoyable activities. And as the physiotherapist on the team, are we creating this movement plan, this physical activity plan, physical functioning plan, in a way that really supports the overall goal of the patient. Um, and so that's what I have for now. Happy to answer some questions as we get going, but I'm going to pass this off to Jessica now. Thank you.
Hello, my name is Jessica Friesen. I'm a psychologist at One to One. I'm here today to talk about pain and not just physical experience, but the emotional and psychological journey of managing it. My own experience with chronic pain has shaped how I understand pain self-management. Pain is complex. It affects your body, your mind, your relationships, and your sense of self. Psychologists play a central role in pain management for those experiencing chronic pain. I'll share my slides here. Can everybody see that? Okay. Key roles of a psychologist in pain management are assessment and understanding, psychological interventions, education and reframing, and skill building for self-management. Understanding how pain affects a person's thoughts, emotions, and behaviors and daily functioning can help build a tailored plan for the client. Pain-related stressors are individual, and exploring what causes these individual stressors can help build coping mechanisms. These are important because pain affects relationships, work, and mood. I also want to assess for a grief or trauma component. One overlooked factor in pain might be grief, not just grief from loss of life, but the loss of identity, routine, expectations. Grief can amplify pain or dull them. It's unpredictable, but it's real. Is your pain due to an accident? Assessing for trauma, we might implement a trauma-informed approach. Validation and understanding. Validation of how hard this is important. Pain can be incredibly draining, sapping your energy, your hope. Even the smallest step should be celebrated. Observe your pain without judgment. Taking time to practice mindfulness can reduce some of the emotional reactivity to it. Knowing yourself and what will motivate you to continue to be proactive in your pain. Motivation is a huge factor in self-management. You need a why, you need a want to. This is why goals are so important. I like to focus on smart, achievable goals. We want to be specific and have goals that are measurable and achievable and relevant and timely. This approach helps individuals and organizations create effective goals that can lead to better outcomes and increase motivation. Where do you see yourself a year from now? What do you need to be doing 6 months, 3 months, a month, a week, a day to reach these goals? If this is too overwhelming, think smaller. Where do you see yourself in a week? Don't focus on seeing results, just actively doing. Even doing 5 to 10 reps of an exercise is a huge accomplishment. Education and reframing. Educating patients about the nature of chronic pain that is often not a sign of ongoing tissue damage, but complex brain-body experiencing. Helping patients reframe their pain experience to reduce fear, catastrophizing, and helplessness. Pain is more complex than people realize. It's emotional, cognitive, and affects people socially. Pain can be thought of as a cycle, each point affecting the other. Physical pain, injury, illness, or chronic condition triggers discomfort, signals the brain to initiate pain response. Pain leads to feeling of frustration, sadness, anxiety, hopelessness. Emotional distress can amplify the perception of pain. Cognitive impact, negative thoughts. This will never get better, reinforcing suffering. Catastrophizing and rumination increases pain sensitivity. Social consequences, withdrawal from social relationships, activities, misunderstanding or lack of support from others. Behavioral changes, avoidance, reduced activity, poor sleep, coping mechanisms. Example might lead to substance use. These behaviors can worsen with physical symptoms. The cycle continues, often intensifying over time. Processing pain is done in the body as well as the mind. The amygdala, prefrontal cortex, and limbic system all play roles in this process. Think of how birds fly. Flight does not only come from their wings. Stress, anxiety, and grief can amplify pain signals. Pain can change how we define ourselves. Pain can lead to catastrophizing thoughts, increasing fear of movement, which can lead to avoidance. Psychological interventions. Pain self-management is actively participating in your own recovery and well-being, even when pain persists. Pain self-management is active, individual. This may include cognitive, behavioral, or lifestyle changes. Psychologists use evidence-based therapies to help individuals manage pain more effectively. CBT helps patients identify and change negative thought patterns and behaviors that worsen with pain. Acceptance and commitment therapy encourage acceptance of pain while committing to meaningful life activities. Slide for that too. Focus on values and committed action while pain is important. Reframing is important. While being pain-free may not be possible with chronic pain, pain self-management means redefining success, not being pain-free, but regaining function and purpose. Mindfulness-based pain stress reduction teaches awareness, non-judgmental acceptance of pain sensations. This may include relaxation techniques, including breathing exercises, progressive muscle relaxation, and guided imagery. Might use biofeedback and hypnosis, used to regulate psychological responses and reduce pain perception. Skill building for pain self-management is important. So we've talked about acceptance, acknowledging persistent pain, and commitment to move forward. Pacing, balance activities to rest to avoid flare-ups. And then coming up with a plan for those flare-ups. Planning and prioritizing, organizing daily tasks to reduce overwhelming the client. Goal setting, we talked about. Relaxation techniques to reduce tension and stress. Stretching and exercise, maintaining mobility and strength. Tracking progress. And then setback planning, I feel, is important for those flare-up and coping strategies, because when we're developing new skills, there is going to be a time that we might relapse to our old ways, and normalizing that and being okay with it. Making sure we have connections to self and others is important. Social connections can be difficult with pain, but isolation can amplify it. Planning activities with friends and family is important. Being mindful of the space and the duration, and knowing your body and not pushing yourself beyond your limit. If you have a window of 3 hours, making sure that you might do activities for an hour and a half just so you have success with that. This might include having a quick coffee at home or a chat on the phone with someone. Taking time to reconnect with yourself is important. Ask yourself, who were you before the pain? What parts of you are still here? Let emotions arise. Don't suppress or judgment. They're part of healing. Explore your strengths, passions, and past resilience, knowing that your story still matters. Create a list of things you can do on tough pain days that still connect you to your value. Pain self-management is about reclaiming how you see yourself, knowing you are more than your pain, and your values, goals, and relationships still matter. Interdisciplinary collaboration. Often psychologists work as a part of a multidisciplinary team with physicians, physiotherapists, and other health professionals. This team-based approach improves outcomes and reduces reliance on medication and invasive procedures. Thank you for being here. You're not alone in this journey.
Thank you very much to our presenters and panelists. We will now move on to some questions. So the first one, Tyler, I was going to say, Tyler, if you want to come back. The first one I'll ask Virginia. These are questions that we receive. Peer support often provides something that clinical care cannot, in your experience, right? So in your experience, what role does shared understanding and connection play in managing chronic pain?
Wow. I think it plays a lot of, a real role in the understanding the other person's experience. That me too, I get it. I find for me within the peer support groups, it's that place where you can remove the mask, that place you can go in and feel safe. Often people living with pain have struggled for people to understand what they're doing or what they're going through. So I think the biggest thing is that understanding that, hey, I get it, me too. I also feel, another great thing that peer support offers is you take these wonderful materials they learn from the healthcare providers, and now we can work with each other or share how we've taken this and put it into our daily lives. So there's in multiple ways that peer support is able to support others.
Very much. Tyler, I hear this all the time. Many people with chronic pain actually fear that exercise will make their pain worse. And with fibromyalgia, especially, exercise is so very important as a self-management tool. So, how do you approach helping someone rebuild? I know you mentioned building confidence, but how do you actually help them when they have so much fear? And how do you help them rebuild that confidence that they can move?
Yeah, that's a great question. And we know, physical activity and exercise are really important, not only from potential pain management strategy, but just healthy living, right? And improving health. So um, we really have to break it down, right? And most often we're thinking of movement and exercise as um, like I have to go for a 20-minute walk and I have to go to the gym and do 3 sets of 10 or 12, but it doesn't quite have to be that, right? And there's often times when you're thinking of movement as this continuum, right? We can even look at brain-based strategies to like visualization, right? Even the things of like mirror therapy and those types of things that we can start to implement. But ultimately, when we're kind of starting with the physical aspect of moving, it's starting really low, right? And sometimes we just break it down into different types of movement, whether it's we just want to start with some deep breathing, right? Let's do some deep breaths. You're struggling to maybe bend down, touch your toes, or those types of things, and we try to make that relatable to the movement. When you're taking this big breath, you're getting these subtle movements in the low back and the rib cage all the way up. And so that's initiating that process. And once we see a little bit of okay, that process is happening, right? We are feeling more confident in there, and then it's okay. Let's maybe do a little bit of walking. Or where are you confident? You just go look on a scale of like 0 to 10. I'm not confident at all. I'm very confident. If you're hitting it at 7 mark, that's okay. Let's maybe try that, right? Often that can be uh, are you a 5 minute walk? Maybe it's from the bed to the kitchen and sitting in the chair for 5-10 minutes and back. So um, it's really where the person is, Trudy, to answer that question. You have to meet them where they are, and we have to try to find a way to set people up for success so that we can see that change. And then also kind of taking a bit of an education in pain is going to be part of this process. But what's the tolerable amount of pain? When is it too much? When do we need to scale it back? When can we move further? When do we just have to keep it as is? It doesn't always have to be a linear progression.
Thank you, Tyler. Jessica, I have a question for you as well. So many people living with chronic pain describe feeling misunderstood and dismissed. And I would say that many is a large majority of people with chronic pain. So, from your perspective, how can healthcare professionals and support networks better validate and respond to those experiences?
I would say taking time to listen to clients and patients about their experiences. Also, when I talk to clients when they're going in to see doctors, it's often overwhelming. So it's good to come up with a plan and points that you really want to share with your healthcare providers and make sure that there are things that you need before you leave that appointment.
Okay, that's a good answer, actually. So, our
Yeah.
time is 4:58. So I just want to ask, Tyler, I don't know if today is the day you have a hard stop at 5, or are you good with me asking more questions?
I'm okay, but can I add something to that last question, Trudy, if that's okay, if there's a little bit of time.
Definitely, definitely.
And I think in one, that's going to be Mike's talk on Wednesday. So that's a great segue into that, Jessica. And Mike will be talking a bit more of communication and a healthcare appointment and stuff, which would be really important. But I also feel like the onus is too on the healthcare provider um, to earn that trust and create that space for that listening. To ensure that that people are as feelings and experiences not being dismissed in any way. And so that's such an important piece of what we're trying to get out there for the healthcare providers as well, is to ensure that they have this understanding of the previous experiences, and now that we know better, how do we do better?
Um, okay, so I'm going to ask you each one question, and then I'll put some questions in the chat. So, chronic pain can affect every aspect of a person's life. That's physical, emotional, and social. So, just very quickly, from each of your perspectives, what does effective pain self management
Pauline speaking.
truly mean and truly look like?
Maybe I'll start on that,
Thank
or
you, Tyler.
yeah, sure. It's building the tools that are necessary for the person to um, uh, be able to feel like they don't need to rely so much, especially on healthcare providers and others, to be doing the things that they enjoy and they love to do. And so, from the tools that we can help people create, um, we need to be able to kind of hear what's meaningful to them, and say, okay, what is a realistic tool and what strategy can help here, and have we set this individual up for success, in the sense, are they able to take this and work on it and feel confident that they can do it themselves? So I'd say that's kind of in a nutshell what I would say, like, effective kind of self-management would look like, from my perspective.
Okay, Virginia?
Yeah, I'm happy to chime in too. And I think, Tyler's quite said it. It's building the tools, but it's identifying also the tools that work for you with the support of your healthcare provider and with others living with pain. And to realize that as you move along in this journey, something that's working today may not work in a year's time. The pain may change, things may change in your life. So always have that flare up kit or that kit that's around that you can go back to and look at. Do I have to rebuild things? Do I have to develop things? And to realize that I think really effective self managers to realize too, that you're not alone. You're not alone, that there's people who will walk alongside you through this journey.
Jessica? Sorry.
I would build, add to that the quality of life, and then building that autonomy, but knowing that you can do it with that community as well, and then keeping those skills up, right? And knowing that they will change, but also looking back and seeing what was successful and knowing you have that resilience and you can continue to learn and develop no matter what your goals are.
Thank you. So collaboration across disciplines is basically essential in supporting people with chronic pain. So how can professionals and peer support groups work together more effectively to empower patients? I'll start with you, Tyler.
Well, I think it's these types of things right here is a really good start, showing how we can come together with a common goal and deliver this type of information. And I also feel like within having the patient as goals in mind, right, and understanding what resources are available to them to help them attain those goals. And when you're taking the time to listen and to hear, and then you also have the understanding of what potentially could be the priority and what may be needed, and the resources in the community like the PIPN and FACT, and you're able to guide people in the right directions. And if there's a built-in communication network, then that only enhances the experience and the support that the patients can attain from that connection.
Virginia? Thank you, Tyler.
I love this question because this is, the thing I'll always put out, how can we work together? I think first is to remove the silos. I think healthcare providers, and I know Tyler will talk more about this later in the week, sometimes aren't working together, but they're coming further with that, working together and sharing what the person needs in order to better support them in the journey. But I think it's time we realize that the peer support is a part of it. And we're fortunate at organizations like One-to-One Wellness, in fact, and lucky here in the Western Zone that our pain clinic, we work very closely together, realizing how peer support complements the roles and what they do and how we can support each other. So I think it's just realizing in the big picture there is no silos in this. Chronic pain is complex, and the more we get together and we talk and we discuss, the stronger we will all grow. Collaboration is hugely important.
Thank you, Virginia. Jessica?
Yeah, just looking at the whole person, right? We're not going to see as much improvement in isolation as we are in a community, right? There's strength in numbers. That applies here.
Thank you very much. I do have more questions, but I am cognizant of time. So I think it's time to wrap it up. I really, really want to thank our panelists for presentations that they gave. It's been really worthwhile. Thank you very much. And thank you everyone for attending today. You will find links to PIPN, FAC, and One-to-One Wellness in the chat, along with the link to sign up for Wednesday's presentation and Friday's presentation. I want to mention that Friday's presentation is 1 hour earlier because of Halloween. We are in the Maritimes and Newfoundland as well. We're an hour ahead. So we have to be available for Halloween. And so that will start at 2 p.m. Eastern on Friday, which is 3 p.m. Atlantic time, 3:30 Newfoundland time. So Wednesdays is the same as it was today, which is 3 p.m. Eastern time, 4 Atlantic, and 4:30 Newfoundland time. And if I was really clever, I could go in my head and say Mountain time, and Pacific time, etc. But anyway, thank you very much, everyone. Thank you, Virginia. Thank you, Tyler. Thank you, Jessica, for presenting today. It really was great to see you all. And I think this is really a great way to start that we're all talking about. Excuse me. And to understand that people do need self-management tools, because I'm sure chronic pain, as it is in the same in the fibromyalgia community, everyone is different. And what works for one person does not work for another. And that's why self-management tools are so important and so individualized. And I, I do agree that peer support is a necessary feature of living with what are invisible conditions, because we don't look sick. And so everyone thinks, how can you be sick if you look as good as you do? And it's nice to talk to people who walk in your shoes and know exactly what it feels like. So, and it's great to have Jessica and Tyler, two people who are supporting people and do get that concept that we're talking about. Once again, thank you, everybody. And we'll hopefully see you on Wednesday.